Is it bile coming on the stomach?
Okay.
Nasıl tube?
My name is Kjell Kiplesund. I am the founder of Nordic Medical Centre. One of the biggest needs in this country is emergency medicine and emergency surgery. I decided to start something that could build up the quality within emergency medicine and traumatology. I came to Ethiopia as a child in 1965. My parents, they are from Norway and they came here as teachers at a Norwegian school. In 2008, I started a foundation in Norway named Trauma Care Ethiopia. That was actually an NGO. But it was difficult to get enough funds to run an NGO. After I met with the health minister, the current general secretary of WHO, Dr. Theodros, he said, please build a hospital that can set some new standards in the country.
I initially came to Ethiopia in 2014 to help Dr. Kjell and Richard launch the Nordic Medical Centre. One of the major problems was we had no way to get people to us. Because of the lack of a mapping system, it's really hard to find and pinpoint people. You would get someone close to you in terms of a cab, but then they would spend a lot of time just trying to circle around and trying to pinpoint exactly where you are.
Network outages, blackouts, road closures, those things would be more or less controlled for in an EMS setting, whereas those things in Ethiopia could happen at any point. So when Jordan came to me with this idea that maybe we could build something that was more app-based, how do we do it in a way that take these things into consideration so it's actually resilient to these types of changes? It started our journey towards creating the first EMS system in Ethiopia.
Chris and Jordan, they came here first in, was it 2014, I think? They are a bit of a sort of a nerds in the way that they, technology-wise, they are very, very experienced. The idea together with Jordan and Chris came up that why not utilize the technology. It's available outside Ethiopia. Let us bring it here and set up emergency call center. Can really pick up the emergencies outside the hospital and give a good first hand and first aid help.
So with our system, what we were able to do is as soon as a patient or someone had an accident, they could press on their app, immediately call us, and our dispatcher would be able to know exactly where you are and dispatch the ambulance to your exact location.
So the first thing that happens is we get the request at the ECC. They'll see where the patient is and they'll see where the closest ambulance is.
So when the ECC dispatches this ambulance, we actually get the request on our tablet. We get the patient information, including their blood type and all medical history. We accept the request and then we know exactly where to go based on the GPS data.
This is a web-based system that can easily be moved around in the hospital. It can be moved outside the hospital. So here we have now trained 10 nurses that are working here 24/7. Give the first aid, give the information that is needed to tackle the situation until the ambulance is being dispatched and come there with the paramedical people. And we really hope that this system can also be a national system in Ethiopia as we are moving on.
When we started NMC, we wanted to be a self-sustaining hospital, meaning that we wouldn't have to continuously rely on donations. So what we did is we decided to target a more affluent community and then use all that money for our charitable endeavors. A lot of work for some of the less fortunate people, but as well we would also focus on education.
My name is Meseret, head nurse for the operating theatre. I'm also working as assistant nursing director in Nordic. I have been a nurse in total 12 years.
So the first one would be the second patient we're writing down. So we will do it in the room.
I like to work in a theatre because I like to work with people who cannot speak for their own.
Meseret, she is the head nurse here. She is one of our biggest treasure in the hospital. Wasn't that what I should say about you? Yeah. And the most important value that we have in a health institution is the human resources. That's also one of the reasons why we last year started a nursing school.
So the NMC Institute for Higher Education started from a master's program, but now even a bachelor's program to train nurses basically from scratch.
We think it could be a big asset for the country when they move around, that they also can be inspirer for others.
I think we need to have a facility like this because it collaborates with the center we have in Nordic, and they may have a chance to see what the practical things are. They know in theory and they may practice into a practical attachment in our setup.
The government, they have benchmarked our programs to be the standard for postgraduate nursing in the country. So the model that we built up has actually been functional, and we see that these programs now are copied into many colleges and hospitals around in Ethiopia. There's 270-degree view of Addis, and see that this is really an expanding city. All the high-raised buildings here are buildings that have been built during the last 10 to 15 years. I worked in a government hospital in the southern part of Ethiopia, and every day we had 200-300 patients in the OPD clinic, and it was just a big mess. So I went home to my wife and I told her, I think we have to go back to Norway because there is no need for us here, and there is no use, because I mean it fills up every time, and where is it going to end? And then it was one lady one day that came and she fell down and she started to kiss my feet, and I said, stop that one, what is it? And she looked up to me and she cried and she said, I just want to thank you because you have saved my son, you have saved myself, and you have saved my whole family. And I said, what bullshit is this? And she said, perhaps you don't remember it, but I came with my only son and he was dehydrated. He was more dead than alive when he came, and you gave him some fluid or whatever. I don't remember what I did. But she said, this boy is my future. It's my family future. Even if it was an ocean of patients, the ocean consists of drops. And that lady has since then been on top of my mind when I feel that it is too much to be here. I have to see the individuals in what I do. And having people that we are working with together here see that we share some of the visions, we share some of the quality visions, it is quite encouraging to continue.